Hi, I'm Ellen Turner. I've been in the chemical industry and materials industry my entire career. I used to work in a company that specialized in specialty plastics for medical devices. And I was trying to understand who in the industry of healthcare cared about more chemically resistant materials to make things that go in the hospital because I was trying to understand how our polymer could be of help there. And what I did was I attended several trade events and I met Linda Liebert, who was championing and obviously had founded the Healthcare Services Institute. And I attended one of the first summits and several thereafter. And what I thought was really neat is how I was connected to other individuals in the market who understood materials and wanted to create something to help people design with better materials that were better for healthcare because they could hold up to disinfectants and drugs and various things that needed chemical resistance in healthcare. And so I joined a task force for testing and validation of materials in medical devices and equipment in healthcare. And I learned a lot, and it was great to be able to work with other scientists who could really put on paper what people really should do to maximize the benefit of any kind of equipment they made for healthcare. And honestly, the way I like to summarize it is when you connect scientists in healthcare at the beginning of the value chain to scientists at materials companies and then scientists who make the medical devices, um, you're connecting all the scientists across the value chain that can put their minds together to solve a problem. So it takes everyone. It takes clinicians, it takes material scientists, and many others that can support this effort. And honestly, I think summits are a beautiful catalyst to do that type of work. So you might ask yourself, why would a chemical engineer with an MBA in the chemical industry where we make materials, why would that person be interested in attending an HSI summit? Well, the answer is you need to connect the dots with scientists across the entire value chain, from the scientist who's touching the patient all the way back to the scientists who are creating the materials that go into the device that clinician is using on that patient. And then the infection preventionists need to understand that the materials are going to hold up to the prescribed disinfectants in the hospital. So it all works together, and I think everybody needs to help because all of us have a loved one or ourselves in the hospital at some point, and we don't want them to get a healthcare acquired infection.